Welcome to Holistic Cancer Care. I'm Dr. MemetIşık. In this video, we'll provide a comprehensive guide on cervical cancer, from understanding what cervical cancer is and its types to recognizing symptoms, the importance of screening, diagnosis, and exploring treatment options. We're here to empower you with essential knowledge for holistic health and well-being. Cervical cancer is cancer that starts in the cells of the cervix. The cervix is the lower, narrow end of the uterus, connecting the uterus to the vagina. Cervical cancer usually develops slowly over time. Before cancer appears in the cervix, the cells go through changes known as dysplasia, where abnormal cells begin to appear in the cervical tissue. If not destroyed or removed, these abnormal cells may become cancer cells and start to grow and spread more deeply into the cervix and surrounding areas. The cervix has two main parts, the ectocervix and the endocervix. The ectocervix is the outer part of the cervix that can be seen during a gynecologic exam, covered with thin flat cells called squamous cells. The endocervix is the inner part of the cervix that forms a canal connecting the vagina to the uterus, covered with column-shaped glandular cells that make mucus. The squamo-columnar junction, also called the transformation zone, is the border where the endocervix and ectocervix meet. Most cervical cancers begin in this area. The cervix is the lower narrow end of the uterus that connects the uterus to the vagina. It is made up of the internal os, the endocervix, the ectocervix, and the external os. The area where the endocervix and ectocervix meet is called the squamocolumnar junction, which contains both glandular cells from the endocervix and squamous cells from the ectocervix. Cervical cancers are named after the type of cell where the cancer started. The two main types are squamous cell carcinoma and adenocarcinoma. Squamous cell carcinoma develops from cells in the ectocervix and accounts for up to 90% of cervical cancers. Adenocarcinoma develops in the glandular cells of the endocervix. Sometimes cervical cancer has features of both types, called mixed carcinoma or adenosquamous carcinoma. Early on, cervical cancer usually doesn't have symptoms, making it hard to detect. Symptoms usually begin after the cancer has spread. Early-stage symptoms may include vaginal bleeding after sex, after menopause, between periods or periods that are heavier or longer than normal, vaginal discharge that is watery and has a strong odor or contains blood, and pelvic pain or pain during sex. Advanced cervical cancer symptoms may include difficult or painful bowel movements, urination, dull backache, swelling of the legs, pain in the abdomen, and feeling tired. Screening means checking for a disease before there are symptoms. Cervical cancer screening is an important part of routine healthcare for people who have a cervix. The goal is to find precancerous cervical cell changes when treatment can prevent cervical cancer from developing. There are three main ways to screen for cervical cancer: the HPV test, the PAP test, and the HPV PAP co-test. If you have symptoms or screening test results that suggest the possibility of cervical cancer, your doctor will do follow-up tests to find out if it is due to cancer or some other cause. They will usually start with a pelvic exam and rectovaginal exam, followed by diagnostic tests such as colposcopy and biopsy. The results will help plan the best treatment. Cervical cancer is staged based on the extent of cancer in the body. The stages range from stage 1, where cancer is confined to the cervix, to stage 4, where cancer has spread beyond the pelvis or to distant organs. Each stage has subcategories that describe the size and spread of the tumor. Treatment options for cervical cancer depend on the stage and other factors. They include surgery, radiation therapy, chemotherapy, targeted therapy, immunotherapy, and clinical trials. Surgery options range from conization to hysterectomy. Radiation therapy can be external or internal. Chemotherapy uses drugs to kill cancer cells. Targeted therapy and immunotherapy focus on specific mechanisms in cancer cells. Clinical trials offer potential new therapies. Understanding cervical cancer is crucial for early detection and effective treatment. Regular screening and awareness of symptoms can save lives. If you have any concerns or symptoms, consult a health professional. Thank you for watching our video on cervical cancer. We hope you found it informative and helpful. If you did, please give this video a thumbs up. Don't forget to share it with your friends and family to spread awareness. And if you haven't already, hit the subscribe button and turn on notifications so you never miss an update from us. Stay healthy and take care.